The goal behind our Zero Suicide initiative is to ensure intervention at the right time and prevention of deaths, because even one death is too many by suicide. We look at things like how are patients dying by suicide so we can ensure that we're creating proper safety plans for them. We look at the policies and procedures that are necessary to create an environment of care that is suicide safe. And of course, we look at leadership and ensure that our leaders have bought into this initiative. And Brian Mills has been very supportive of it throughout the 5 years we've been working on this initiative. We want to ensure that our patients are healthy and have hope for the future. We were fortunate enough to receive a federal grant from the Substance Abuse and Mental Health Services Administration. This grant has allowed us not only to train our staff and implement suicide-safer care within our network, but also to train others around the state on important evidence-based practices. One of our pathway care coordinators was texting with an individual who was on our pathway. He indicated to her that he had a knife with him and he was cutting himself. And so she utilized the skills that she has learned through all the education we've provided to help ensure that he knew it would be best to lock up the knife and to utilize his safety plan to keep himself safe. Our clients also come in for counseling sessions with therapists. They also see a prescriber, either a psychiatrist or APRN, for medication needs. It's important to address children's mental health issues early so that these issues don't become larger issues as they grow into adolescents and adults. And so we have several programs to support our youth, and they include our Healing Hearts program, Camp Erin, as well as play therapy. Healing Hearts is a program that is made available to youth who have had someone close to them die, either by suicide or natural causes. We provide programming within 2 school systems today, allowing for youth to receive counseling as well as education and support for their trauma and grief associated with the death. So today, the Healing Hearts program is within 2 school districts, but our hope is that with donations, we could expand to all of the schools that behavioral health provides school-based care in. Camp Erin Indianapolis is a bereavement camp available to youth throughout central Indiana. It allows them to attend a weekend camp at which they receive counseling and opportunity to bond with others who have experienced grief in a similar fashion. It's like a typical camp, but with the added benefit of receiving that counseling needed so that they can return to home knowing how to cope with their grief, learning skills to work with others. Because of donations, we were able to provide training to 25 therapists on staff at Community Behavioral Health in play therapy. Play therapy allows for youth suffering from trauma, grief, sorrow, to receive counseling in a manner in which they understand. And so utilizing things like sand tables, puppets, dress-up clothing, and other types of toys, these youth work with their counselors and speak in the language of play. We've been able to more than double the number of play therapists within Indiana through donations to our foundation supporting the training of our therapists.
Community Health Network. Exceptional care, simply delivered.